Hey, it's Donna with my week 15 update, which is extremely late once again, but we're getting used to that. I weigh in on Mondays, but I don't necessarily update until, what's today? Friday. So, the week before, as you may recall, I had a 0 weight loss. So, I was a little bit disturbed, but I figured, those weeks are going to happen. This week I lost 4 pounds, so I'm real happy about that. That keeps me with my approximately 2 to 2.5 pound average per week, so I guess I didn't blow my statistics after all. So yeah, I did have a good week, and I guess I've got like 3 more days before I'll be updating or weighing again, so we'll see how that goes. But so far it looks pretty decent. I wanted to briefly mention a couple things. Well, one is this case study that I was just reading from the Bariatric Nursing and Surgical. Well, it's a nursing journal, and about bariatric surgery. And this is a case study about malnutrition following gastric bypass. And the reason I'm bringing this up is because I hear from time to time, people forget their vitamins, or they just don't take them, or maybe they're quit taking their protein drinks after the however long, I don't know. But I just wanted to bring up a few points about this, because it seems to me that in most cases, maybe not all, but in most cases, people who run into problems are usually non-compliant with the instructions. And here's a lady who, she's 42 years old. She had, this case study describes a patient who had Roux-en-Y gastric bypass surgery and was admitted to the hospital 4 years later with massive weight loss, gross bilateral lower edema, and incisional drainage from a recent surgery. Despite successful weight loss, a comprehensive nutritional assessment revealed poor eating habits, non-compliance with vitamins and minerals, and excessive ice consumption, which is indicative of anemia or a low blood count. Iron deficiency anemia tends to make people crave ice. Due to her malnutrition, a gastrostomy tube was placed and the patient was discharged home on a diet with supplemental tube feedings. The bottom line is she showed up about 2 years or 3 years after her surgery with symptoms of malnutrition. So I'm not going to read the whole thing to you, but essentially she had edema in her legs, abdominal pain, foul-smelling drainage from a previous abdominal wound incision. She had a lot of issues, and the bottom line was she had a history of non-compliance with prescribed multivitamins, iron and calcium supplements, and admitted to having taken them for only the first 6 months after her gastric bypass. According to her diet history, she was consuming approximately 800 calories and 30 to 35 grams of protein per day, and a 10-pound bag of ice weekly with an added 16 to 24 ounces of ice per day. She was walking 3 miles on each day and consuming no food after 7 p.m. So this woman essentially was not getting her follow-up blood work. She was not watching her protein intake, and she was not taking her vitamins. So she ended up admitted to the hospital with all these problems. And, malnutrition is not something that's easily fixed. So there's no point in going there. If you can follow these rules and follow them for the rest of your life, you're probably going to be in pretty good shape. That includes regular blood work too, because the only way you're going to catch this early is to be having your routine blood work. This way, if they see a drop in anything, they can improve that area, that whether it be B12 shots or iron infusions or having you increase your protein. But you need to do that before you're sent home with a feeding tube. And you don't want to spend the rest of your life on any kind of feeding tube and then have to blame the fact that you had gastric bypass surgery gone awry because you didn't follow the instructions. So anyway, that's my little lecture for the day. And I know I'm only 15 weeks out, and I hope not to run into any of those issues. But I just want to encourage everybody to remember that this is a lifelong journey. It doesn't end when your weight falls off. It doesn't end when you're tired of it. it doesn't ever end. Forever you're going to malabsorb nutrients. Forever you're going to have to watch this. And so just do it. Anyway, that's my splurb and my spiel or whatever for today. I am again heading out for the weekend. I have my pedometer in tow, so we're good to go. I hope you're having a great week. Oh, let's see, yeah. The meet and greet Allison is having, I am happy to say, and I'm excited to be going to that. And I think I have talked Diana, one cruise director, into coming along with me. So we're really looking forward to it. And if you're going, I hope you will let me know so I can check out all your videos and make sure I'm kind of familiar with everyone and get to know you before I even get there. Anyway, thanks for checking in and leave a comment. Don't forget to subscribe. Bye.